Yes, we've got a quorum. If we do, and we're recording, we can go ahead and kick this off. No, Lenny's gonna be a little late joining us, but he'll be here. Everybody had a chance to look at our last two sets of minutes.
And first, y'all have to sign off probably with the
Right, that would be super. Anybody had any corrections or changes to the minutes? I wasn't at the last one, so I don't know. I'm sure they're accurate like they always are.
I make a motion to approve both last meeting and the meeting before to approve those minutes.
Here, you want to second that?
Yes, I second that.
Super. Any discussion? Any objection? Okay, our minutes are approved and up to date, so let's get on with our discussion, testing discussion. Marty, are you heading that up?
I certainly can. Not much to report on testing. Going smoothly. You can get more tests from .gov, 5 more if you do not have enough. And we have not had any need, even though we are seeing cases increase, to reopen any testing centers. So it's just being done in clinics and the hospital and at home. The one thing I will say about testing is that we are looking at to see if it's a possibility to obtain the sales of test kits at mainly our large retail pharmacies such as Walmart, to see if there's any correlation between test sales and then hospitalizations 2 or 3 weeks down the road. But that is in discussion right now.
Good. Marty, has anybody seen any data on the sensitivity of our current tests that seem to be getting stockpiled with the newer variants?
Nothing in the past month or so, and with these 2 newer subvariants, I've not seen anything. From previous, and this is still true, is that with these Omicron subvariants, that the rapid antigen tests tend to turn positive a little later in the course of the illness, and then the PCR, being more sensitive, is positive sooner.
But still within 3 days for the rapid antigen?
Sometimes it's 5.
Oh, okay.
Yeah, so it can be well into the course of the illness before the antigen test is turning positive. So, same kind of recommendations as previous. Nobody wants to follow them right now, but still the same recommendation is if you are symptomatic and your antigen test is negative, you should go ahead and get a PCR test.
Very good. School status discussion.
It's summer.
Looking ahead to August.
Nothing going on right now. I've not had any contact with the schools regarding, this coming August. We will be watching carefully because, concern is right now with the decoupling of cases and hospitalizations and deaths, which is wonderful, that trend could reverse here in the next few months as immunity wanes. So we'll be watching that closely.
Great. Vaccine discussion. Anything new going on with the vaccine discussion except we're expanding the population?
Right. Yes, so I'll let Richard discuss that in a minute, as far as the younger children. Pop-up clinics, are still going on, randomly throughout the region. With more uptake of first doses, we are starting to see, which, as the spotlight is not shining so brightly on misinformation, we are starting to see more people coming around for first doses, which is wonderful, and we are seeing that here locally. And then as far as the vaccines for 6 months through age 4, age 5, age 4 for Moderna, age 5 for Pfizer, those doses arrived in the state Monday and are being distributed the same way that they were for ages 5 to 11. So our doses for the city of Fayetteville and Washington County got delivered to the Department of Health for redistribution. I'll let Richard take it from there, discuss where we are.
Sure. We received 7,000 doses in the Northwest region, and we've got it in all of our health units as of today. The external partners that pre-ordered vaccine, we started moving that out, and I should be able to order more vaccine this Friday for next week's delivery. We haven't had a lot of takers yet, but again, we just got it, so we're really hopeful that we're going to see a lot of kiddos come in and get vaccinated.
Gary, what about a community clinic?
Yeah, we get ours through a federal allotment, and so we put in pre-orders for that. We're kind of in the process of getting it received this week, and then getting it out for our clinical needs. We'll be able to start getting this. So we are kind of right in that same process and getting our doses in and ready.
Good. One thing, I'm sure this board's aware, but just to remind everybody that with these doses, Moderna is a 2-dose series, and Pfizer is a 3-dose series. So it's, they're both mRNA vaccines, kind of comparing Pepsi to Coke as far as efficacy, but you get a quicker time to full immunization status with the Moderna vaccine because it's just 2 doses 3 weeks apart as opposed to the Pfizer dose series, which is 3 doses, which is 3 weeks apart, and then the third dose is 8 weeks after the second dose, so it's a longer time frame and one more immunization for those little ones. So I think I have a feeling that we'll see a little bit higher uptake with Moderna than Pfizer, which is kind of flip-flopped is what we had been seeing previously.
Marty has a lot of conversation around Moderna's already testing for a booster for this age range as well. So
right.
In a sense, they'll be likely headed towards a 3-dose, and so I think you're exactly right in terms of Pepsi versus Coke in terms of those efficacy numbers. We're looking at 2 doses versus 3, and small sample sizes, and certainly those calculations. So it really is kind of Pepsi versus Coke, even though the displayed numbers look different, 35% versus 80% efficacy in those kind of things. So really pretty, when we fast forward 6 months, Pfizer versus Moderna will likely look pretty similar. So if your office has it and you have the ability to get it for your child, it's the right healthy thing to do. Probably wouldn't try to, delay because your pediatrician has Pfizer, but you want to get Moderna or anything like that. But just, probably the earlier the better.
Yeah. Exactly. Yeah. The one in front of you is the one to get always. So that's where the vaccines are. And I just got notice that there's going to be, when is this?
July 16th.
July 16th. There's going to be a COVID vaccine pop-up clinic at the Wings and Wheels Fly-In and Car Show at the Arkansas Air Military Museum. So vaccinating people there, and that's Arkansas Foundation for Medical Care with ADH doing that one.
Is that all ages, Marty?
I don't believe it specifies.
I don't think it says. If it's ADH, it should be all ages. One thing that is important to note, and I know some pharmacies are getting some pushback, pharmacists are not licensed or allowed to vaccinate below age 3. So if people go to a pharmacy to get the vaccine for their child, they can't vaccinate if the child is younger than 3. So they'll need to go to the Department of Health or their pediatrician doctor to get the vaccine. However, most of the pop-up clinics are going to be staffed by nurses. So it just depends on if they have the vaccine and the dose, the correct formulation present. But they can vaccinate. But pharmacists cannot vaccinate under the age of 3, period.
New agenda format, Marty?
Yes, let me share my screen. And can everybody see that?
Yes.
All right. So what I am proposing as we move out of concentrating solely on COVID is the following agenda. And this is open for discussion, debate, cuss and discuss. COVID still being our number one topic, cases, testing, hospitalization, vaccinations, and then the dashboard. I am working on a new dashboard with a public health, Master of Public Health intern from the U of A and the Northwest Arkansas Council that is going to look like that roadmap dashboard that we discussed a few weeks ago. So that we're hoping to have it together and beta tested through this winter season and really being internally focused for our hospitals for this first viral season, and then afterwards hoping to have an external facing dashboard for the general public. Like we, again, with the roadmap, discussion of other respiratory viral pathogens, influenza and RSV be the big two, unless we get a pertussis outbreak or something else along those lines. Number 3, mental health. And I'm happy to keep reporting on this, but I'd like other people to stand up and hopefully take ownership of some of these other areas. I'm on the mental health task force for Washington and Benton County. We are looking at access, workforce, and resources. And there's some good momentum going on there. Stephanie is involved as well, but most of the meeting times are during her clinic time, so she's had a hard time making those meetings. Reproductive and sexual health. I put Stephanie and Richard down because they've been kind of taking the lead on this in our meetings prior. And I'm going to pause here because Richard did bring some information on our syphilis cases and our testing supplies. I'm going to let them discuss those issues now.
Well, at the last meeting, you requested some more specific information as close as they could drill down with Washington County as a whole because of the way people live. And we are experiencing an upward trend in STDs and syphilis in the state. That's no surprise to anybody. We're still having a little bit of an issue with supplies. We're doing daily inventories in all of our health units and moving those testing supplies to areas that are of most need. But we're still not turning away anybody that's close contact or symptomatic. We're going ahead and working them up. And as always, all the STD cases, symptomatic folks and team family planners are always priority in our clinics. we'll work them in regardless of how full our schedule is.
Richard, on what you sent us, Washington County is higher than Arkansas, in the US for syphilis and chlamydia. Is that due to our younger population with the university, or what is?
You know, I honestly don't know, Marty. We've had that trend for a while, as you can see from going back to 2017. It's an denser population in the rural areas in Arkansas. When you have more people, you tend to have more contact. So as far as the specifics, I wouldn't venture to guess. That's not my specific field.
Okay. And then I don't know if I had just flipped through it quickly before the meeting. I didn't see any HIV data.
That's reported separately.
Okay. All right. And then Gary, you were at Pride and did some STD screening, or the community clinic was?
Yeah, absolutely. We were able to make it to the Silent Springs Pride events as well as the Fayetteville Pride events. Started, with a kind of small group at Silent Springs, but at Fayetteville, I think, tested 46 individuals for HIV. Did some HIV risk counseling. I talked with some community members about how they might be able, through their lifestyle, be able to reduce the risk of contracting HIV or other STDs. So was we thought large scale success to test that many members and have that many conversations. So we were really happy with that. Really happy with that event.
Dr. Berner, did you get patients making appointments for PrEP?
We have since kind of launching this across our clinic sites and getting our providers all trained to prescribe it. We have had a robust response between that event, our own and patients that we already had, and then I think some folks that have seen some of our outreach and education. But yeah, we are real happy with that response as well.
And that Pride was it was a big event. Do you happen to know what the turnout was in comparison to other years?
I do not. I know that it was not nearly as large as what they were planning on.
Oh, really? Okay.
They were thinking 30 to 40,000 people, and I think that they were, from estimates that I've heard, was closer to 10.
Okay. Very good. Next I have on the proposed agenda, substance misuse and overdoses. And this includes specifically looking at fentanyl getting into local supply chain, for lack of a better term. And we know that is happening here in Northwest Arkansas. So something that we need to be aware of and, discuss. I know that there's a group at the U of A working on distributing the fentanyl test strips, and what we can do to help partner with them in that. Gun violence.
Hey, Marty, on the overdoses, can we get data monthly on the number of overdoses and deaths?
I'm sure that I can from Roger Morris, and I was gonna reach out to him. We can get CDC data, but the most recent is 2020. And if there's less than 10, they are not gonna report it. And I'll show you
I
something.
just didn't know if EMS aggregated that data on calls.
You mean just for morbidity, not mortality?
Yes.
We will look into that. I don't know if EMS does, and they're without a chief right now, so it may be a minute.
Okay.
I can look into that and just see what they report on.
Okay.
Because I know that obviously they're carrying our canvas, so does Fayetteville PD, Springdale Fire, Springdale PD, and Fayetteville Fire all carry Narcan.
Yeah, I think exact numbers may be hard, and, private individuals are carrying Narcan now, so.
It is readily available and used often.
I'm glad it's readily available, I'm sad that it needs to be used often. Healthy community design, trails, trees, and parks, and there was something, were you at the city council last night?
I was not.
Okay, there was something on the agenda, regarding trees, and I went with the urban forestry, and I didn't see it reported in the news if it got passed or not.
I
was
did
just-
not see anything.
Becky,
Yes.
before we move on, about the gun violence, I know that we're just kind of talking about our planned agenda, but I did want to make sure I mentioned before I forgot, that, I've had a couple of concerned, parents and patients. Apparently, there are questions about, like, schools and what their protocol is to alert both students and their families of, like an active situation.
Okay.
Apparently there was recently one where the parents knew about it, but the students did not. And of course, they were getting frantic phone calls from parents because nobody knew what was going on. So just making sure that our schools know the protocols to follow for, active issues.
And that might be, something that we could roundtable with the police and the, school board and us. And I think it'd be timely to do this summer. I'm sure that there's discussions going on, given Uvalde, so. Good point. Let me. School concerns, we'll write that down. Climate change, Maine really worried right now, about, especially going into this weekend with the heat. And then tornadoes and flooding, we already know are an issue. As a matter of fact, one of the agenda items that was passed on the city council was reimbursing a family for flooding, but that was related to a pipe. But reminding everybody to stay cool, and please, we haven't had any reports yet, but we will in our area of a child being left in the car, so everybody beware. And then the last thing I have is the racism as a public health crisis. If y'all remember back in the summer of 2020, the Board of Health passed this motion, and it's a full document. I think it's very important to understand that while racism is a public health crisis, public health cannot and will not solve systemic racism. And so that there's some confusion on that. But I do think that we need to form a subcommittee now that COVID is dying down to discuss the issues that we can, the steps we can take to address this issue, because we did pass that and we have not acted on it since then. However, I think a lot of what we've discussed, if we go forward with an agenda such as I proposed, we will be starting to address some of that, not all of it. And then I'm gonna stop sharing and jump over to one other thing. Hold on, and reshare.
Marty, while you're pulling that up, thinking of the racism piece is just, overall social determinants of health.
Yes.
From transportation to education to housing to, I don't have the list, but there's,
Right.
Probably 13 things listed under social determinants of health. Finances,
Right.
Access to healthcare.
Education.
Again, we could have 4-hour meeting, we had all these things on the agenda, I don't know how to set this up.
Right.
The agenda, we have certain items each meeting, but just other pieces to think about that we could.
Yeah. No, absolutely.
Have on quarterly agenda or something.
right, and something to brainstorm, do we, hit one, and again, I'm kinda like for that subcommittee to start looking at those very things. Like I said, I met with Jake McClarty, who's the new housing person for Northwest Arkansas Council, really urged him to look at South Fayetteville, and some of our housing concerns there. Education, keeping students enrolled through high school, there's so many things. So we need to start breaking that down a little bit, but again, knowing that we are not going to solve those issues, but what can we do to maybe move the ball forward, even if it's just an inch, it is better than nothing. And then I just wanted to, this is from the CDC, and I just wanted to, let's look at 2020, the year, this most recent data from the CDC, and I'm gonna ask Roger for more up-to-date and more data. Again, if there's less than 10 deaths, it's not reported. But cardiovascular disease in aggregate was by far our number one cause of death in 2020, followed by COVID, and then cancer. And this is all of them in aggregate. Lung cancer being number one. And then one thing that surprised me, Hershey, is where bladder cancer was on this list, how high it was. Is that unusual?
The bladder cancer is where I would expect it to be in the ranking. What
Okay,
is really surprising to me is where breast and prostate are. And we addressed that when I was on the breast care board and on the prostate foundation. Those should be up on par with lung cancer. And that's a screening issue. And I don't know if this is across the county in general, but we attempted in terms of our minority populations, which are significantly underscreened for prostate, to try to work on some education and screening clinics. But those two are not where they should be. Colon and bladder are about where I would expect them.
okay. All right. Interesting. I thought bladder cancer was high, but and again, this is looking at mortality, and I want to dig into more morbidity. And then I was also surprised that dementia was next, above COPD and stroke. But looking at this, I put my proposed agenda together before I pulled this data. So I don't know if we want to put cancer screenings as one of our action items on our agenda. Or if we want to, you said lung cancer is probably where it is, tobacco. So anyway, I'm opening the floor for discussion on how y'all would like to move forward and what you would want to include.
Sure, Dr. Sharkey, I would like to share. We do have a breast care program at the health unit where we do comprehensive screening and referrals for women. We also have a hypertension clinic that we're starting at the Fayetteville Health Unit along with Wise Woman. So some of those resources are there, and I'd love to get that information to you so you can see where we're going with some of that stuff. And we also have resources available for Hometown Health Coalition. We have a program called Hometown Health, which we have resources that can go out and do education to community groups and such to try to increase awareness and promote screening and early prevention of a lot of the cancers that we're talking about.
Wonderful.
Thanks a lot, Marty, for outlining all of this. I think it's really good. I would actually vote to include cancer screening,
Okay,
actually, in one of the talking points. I still battle with that and trying to convince people to get things done like colonoscopies and how important mammograms are. And I think that that's a responsibility that we have. I think one of the other things that I would also add has to do with women's health resources. Again, this is not a political committee, this is a medical committee. And so outside of what anybody may or may not feel, depending on what happens in DC and what happens along the other states, we're going to have to continue to evaluate what women's health resources are going to look like for women that are pregnant. That's just a reality, and I think that needs to be included in our agenda points as well.
all right, well, I have reproductive and sexual health, and I'll just,
Oh, okay. Sorry, Marty.
that's okay, I'll just make that a little broader too
Okay.
for women, and then I'll go ahead and add cancer screening efforts to that as well.
The other question I had, Marty, I'm sorry, I came in late, was, as far as monkeypox being in the media, and, yesterday they talked about a suspected case, I guess, in Kansas City.
Mm-hmm.
And so is there any additional information, as far as, again, educating the public on, what to look for, how it's tested, that type of a thing?
Yeah, I've done some media outreach on monkeypox, and just knowing right now that we are kind of not where we were, but it's a different virus, but that the testing is low. We know that we're not testing enough, there's more cases that have been identified. So everybody needs to be aware. Normally monkeypox starts on the face and spreads to the torso, but it can spread through sexual contact, in which case the rash normally starts in the genitalia area and spreads from there. It is not aerosolized, but it can be droplet spread, so if you're within a few feet of somebody discussing something, or if there is skin-to-skin contact with an open sore, it can be spread. And the name's probably gonna change here shortly.
Thanks a lot, Marty.
The thing that I'm thinking about is like, it's a little bit esoteric perhaps, but how are we going to make an impact as the Fayetteville Board of Health? Do we want to be kind of a awareness and reporting entity? So we report on these topics and kind of look for trends. So gosh, we see a trend in opioid overdoses. So now we can start to try to implement whatever resources we have. But we're not a group with a lot of time. Marty spends far more time with this group than I certainly do. But how can we best utilize our minds, or utilize this group? We have some really sharp folks on here. But what's the best way for us to? Because now we're starting to look at a lot of topics. So what's the best way that we can utilize our time? I don't have an answer, but just trying to think through that a bit. I don't know if Marty has any thoughts, or anyone else in this group has thoughts towards that.
My first inclination is awareness and spotting trends, because what we saw with COVID is if nobody's watching hypervigilantly on the local level, things get missed. So for instance, looking at this, and Hershey knows that, I look at this and I think colon cancer is not in the right place, but Hershey says breast or prostate are. So we're not screening enough. So we need to make awareness on that, and that's just, this took me 15 minutes to put together. So just by us digging a little bit into the data, I think that we can make a significant impact just because nobody is looking locally. And knowing also that we can get ahead of the data, Richard has to wait on ADH and CDC. I know that we can reach out to local partners and get more up-to-date data and more timely data.
Yeah, I like that, you know, by kind of having regular reporting, we can have a group that's keeping kind of eyes on Fayetteville. That makes a lot of sense to me, and then connection to resources and awareness of resources. As we are thinking about gun violence, I know our community clinic has reached out to Fayetteville, has reached out to Arkansas State Police, and has found several resources that can do active shooter training, you know, and kind of that type of targeted training. So, you know, perhaps we can even have a group on per week or whatever, and have a group that's that, you know, maybe most Fayetteville citizens aren't aware of, that's providing transportation or utility or clean water resources that we can share and kind of bring some awareness to the community or anybody else.
And I'm thinking back also to earlier days in the pandemic where I was actively bringing in guests to the board as I was working on issues, and then the media would pick up on what we were discussing, and it brought, you know, it just helped shine the light on what was needed, what was being done, what we can do. Because there's a lot of people working in silos, and not, if we can help highlight those things, I think it will make a difference in our community.
Dr. Sharkey, we may want to also include or at least consider basically, you know, access to, you know, food. I know that a lot of people are facing like eviction and having issues finding housing, finding jobs, those type of things. So I know that that's still an ongoing thing. So I'm not really sure about our status of like the food banks and those type of things.
So nutrition, food security. That may.
I'd be happy to kind of write up a section of social determinants of health and get that to you.
Yeah.
Again,
There's so many.
Yeah. There's classically 13 topics.
Yeah.
So again, we could figure out a way to, you know, address 3 or 4 at a time, or report on a few at a time. But
no, that'd be
I'd
great.
happy to get that to you this week.
No, that'd be wonderful, because when I was writing this up, I was like, how do we wrap our arms around the social determinants of health and deal with everything else in public health as a small board? So that would be, if we could, you know, like I said, probably more have a rotation on that, I think is a good idea, because my head explodes when it starts getting much beyond what I have. And again, we don't want, you know, 5-hour meetings. So that would be great. So I'll turn it over to Hershey, you know, as far as I will send him this proposed agenda. And then, like I said, I can't formally make a motion, but I would love it if people would stand up to be to look at go back and look at the racism as a public health crisis document and look at what we can start doing to move the ball forward there. So that's what I have.
Super. Other business. I have something I wanted to highlight, if there's nothing else anybody has that's pressing. And that's the cost of antivirals. Most of what I prescribed was through our pharmacy, but I had a patient that followed up on that went to Walmart for their Paxlovid. And I was not aware that there are pharmacies that charge for that. And it's very disturbing to me. This patient went to their neighborhood market and was told they needed their insurance card, which they didn't have. So they went home and got it, came back with their insurance card. They ran the insurance card and then said their copay was $20. And I know our pharmacy gives them out for nothing. I know Deputies and Rogers does. I know Collier's does. They just dispense it. Go to the counter, you get your prescription. And so I called that neighborhood market and asked, well, wait a minute, why are you going against, why did you need an insurance card and why was there a $20 copay on something? And I was told it's their processing fee. And I don't know how many millions of dollars they're making on that. Because I bet the bulk of antivirals are coming through big box pharmacies. And I don't know, I never called CVS to see if they're doing it or Walgreens. But Walmart's the gorilla in the
Stephanie, didn't you fill a Paxlovid for yourself just to try it?
Yeah, so, after we had a discussion before the last meeting, because I had issues, you know, with prescribing, I went ahead and prescribed Paxlovid to myself, and, whenever I went to pick it up, they have my insurance on file, and so it was a $0 copay. But in the little area where it says, you know, cash pay, it said $20, and so I'm not sure if that would have been like, if I had not used my insurance, it was $20 or what. I mean, that is really disturbing.
Well, and also since you can get a $4 prescription at Walmart, so why would Paxlovid, which is free, be a $20 processing fee?
Well, the person I talked to at the neighborhood market said it costs them to process. But you're right. I mean, it doesn't cost any more than the Benadryl to process.
And they put a label on it, like everything else.
Well, I mean, to me, that's an educational issue, or maybe it's an educational issue, and maybe the Northwest Arkansas Council needs to address that. If big box stores are fleecing our population, I mean, that's concerning to me, because some of my patients, $20 is not an insignificant out-of-pocket for them. And I don't know why this one patient in particular had to run his insurance and then had a $20 code. So I don't know what the billing is if you've got insurance, but I'm glad to know some of them are zero copays, but somebody's getting hit with a processing fee. Anybody else notice that or know what other big box pharmacies are doing for that?
I do not.
My assumption is that's money left on the table. If Walmart's doing it, I would be surprised if Walgreens and CVS aren't all. And I don't know how to educate the population about that is a drug that's provided free. If you're getting charged for it, try another pharmacy. Of course, that's going to get a swamp with sending e-scripts to multiple pharmacies. I'll call around before our next meeting and see if the other big boxes are doing that. But the 4 local pharmacies I know that we deal with a lot don't have a processing fee attached.
And that's Collier's and where else?
Collier's, Debbie's, and Rogers, our pharmacy, which has 3 locations, and Medical Arts in South Fayetteville.
Gary, do you know if community pharmacy is?
Well, you know, I can't speak specifically for them. Community Clinic has our own federal supply, and there's certainly no charge for our own supply. So every script that I've sent out has been through our own supply, and there hasn't been a charge. I would make an assumption that community pharmacy, does not have, but despite similar name, we don't have a business relationship.
Just maybe they're next door.
But I would make an assumption that they're not charging. I know community clinic is not charging for ours.
I'll try to get some more information on other pharmacies to see if it's a big box issue or how pervasive that is.
That would be great.
Any other business? Marty, do we want to send out that proposed agenda item that's modified to the board and let us all take a look at an email and then adopt it at the next meeting?
That would be great. I will send it out.
And looking at the next meeting, do we want to continue to meet second and fourth, or for July and August? Do we want to go with just once a month?
I would propose just once a month through this summer, unless something pops up.
How about the second Wednesday of August and July?
Right, July 13th and August 10th.
Perfect. Unless something comes up.
Right.
Okay, let's do that. Any other business? Any hands on attendees? Don't see any hands up. Everybody stay cool and safe out there and have a good 4th, and we'll see you in a couple of weeks.
Mm-hmm.